All right, we are in week 4. This is for the MN662 psychotherapy class, and this is my journal. So, briefly discuss a client encounter you had this week and note the therapy modality used and what the diagnosis was. Oh, so we had a 13-year-old that was having thoughts of hurting themselves. This would have been, so they've had 2 attempts prior, one by hanging, one by OD, in the last 3 years. And we had just a follow-up call. She is MDD with psychotic features. She sees shadows and she randomly hears voices. So we did a follow-up call. It was a monthly call. And yeah, it was like they were eating out, and then the mom and the child went to the car to have the therapy session, and they seemed like everything was fine. Started with the encounter questions of anything changed since the last time you've seen Dr. Eugene, and is there any changes in your sleep, any changes in your appetite? And then mom just kind of buds in and says, well, I'm going to tell you right now that she's having thoughts of wanting to hurt herself, and she's had them for the last couple of days. I'm like, okay. So I talked to the patient, and so you're having thoughts of hurting yourself? She's like, yeah. And I asked, do you have a plan? She said, yep, I'm going to take those pills again. And mom is like, I just was waiting for our appointment today to see if what you wanted me to do, take her to the hospital or not. So then my preceptor joined in, as a telehealth, and basically told her, she's having thoughts, she has a plan, she's attempted this plan prior. This is not something that you need, to have an opinion on for her to get care. And told her, anytime that there's a concern this major, you go to the emergency room, or you call and you say, hey, I need to talk to someone now. You don't wait. You don't have to wait for an appointment. Mom was just really relaxed, like, yeah. And so my preceptor was asking her, well, what's your plan? What was your plan? How did you keep her safe these last couple of days that she's been saying this? And the mom said, well, I haven't left her alone. She had, she from the prior histories had a plan of safety. So she never left her alone. She slept with the child in her room to ensure nothing happened. There is access to medications per mom. The meds were taken away from her access, and the child was like kind of like laughing. And my preceptor was like, what is the smile for? And she goes, well, does she know everything that's here? And so it was just like, yeah, no, this child needs attention, needs medical attention. So she was referred to the hospital. Mom already knew the routine. She's like, I know what they're gonna do. They're gonna ask the same questions. They're gonna send her to another brain hospital, and then a week later they just give her back to me. And my preceptor was like, I'm gonna call the emergency room and let them know I'm her healthcare provider, mental health care provider, and if what the discharge plan is, I will be involved to guide you through the way. Perhaps we can have a better discharge plan. And you can just see mom's face, like, like, I don't want to go through the same motions and end up here again. So that was really neat. We did do a follow-up call. We did call the hospital. We did make sure she was there. This morning we called. She is being referred to a level 1. What hospital was still pending. And so the plan is once we figure out the hospital, is call the hospital and say we're the community mental health provider and we'd like to be a part of her discharge planning if possible. So do coordination of care. So now consider a psychotherapy session. Okay, so the therapy modality here was the assessment of the patient, and it was, I guess, not really a therapy because the mom just came out and said, hey, this is what's going on. But part of the safety planning is, educating the parents that you don't need permission from your therapist to go to the hospital. And the way that my preceptor said was like, if somebody's having a heart attack, you're not going to call and see if the medical provider will let you go to the hospital. So it's an emergency. Let's see. So this is an adolescent, and what special considerations are more important for this age group and population? So, I mean, there's no other way than to ask, are you having thoughts of hurting yourself? Are you having thoughts of hurting someone else? What is your plan? I mean, there's no other way to ask those. I mean, I think because I've been in psych, those basic questions of, hey, we need to keep you safe. We need to keep others safe. And do you see yourself working with this age group and population in the future of clinical practice? I've worked with adolescents for the last 2 years, so I don't have an issue working with adolescents. I actually would like to work with all of the lifespan. I found that just working with adolescents kind of got me out of the groove with the adult population, because they are different. They're different in how you approach them. They're different in the dosages. They're different in their comorbidities. But I don't mind working with adolescents.